Today we are going to discuss about evaluation of clinical study. Evaluation evaluate the objective of the study, why you are studying, why, what type of product do you have, and why you want to study. Research intended to examine what do you want to find out from the research. Goal is stated clearly. What objective and goals in the quantitative and qualitative you want to achieve. Single objective or multiple effects being tested. Evaluate the subject of the study, healthy affected volunteers, criteria for selection. Because when you go for the clinical trial, clinical study of any new product, you will do this trial on a healthy individual. We call it phase 1 trial. Phase 1 trial, we only look into the pharmacokinetics of the drug by taking blood sample and giving a single dose of that medication. Then you take some blood sample, about 14 cells, and then try to find out how the peak of bioavailability in the body, serum level, will achieve with this drug. So we take healthy individual, healthy or affected in phase 2 and 3. Phase 1 healthy, phase 2 and 3 affected. And criteria for selection means whole screening of the patient will take, healthy individual patient will take place. About 80 different tests in the lab is conducted. Evaluate administration of the treatment. Evaluate administration of the treatment. This evaluation of the treatment is taken place in phase 2 and phase 3, not in phase 1. Evaluate the setting of the study, length of the study, how long. Usually we take 3 days for phase 1, and for phase 2 it will take more time, and phase 3 is taking long time. Physical setting, how you arrange the place where you are taking a healthy individual for test, who collect the data. This all are included in this study. Evaluate methods, design of the study, method clearly described, retrospective and prospective, treatment allocation, parallel design, crossover. Crossover means there are 2 groups. One is a experimental group and one is a control group. Evaluate control, blinding. Blind means you are not going to tell to the patient that what is the drug. Random allocation of the drug. You can give drug to any patient or individual, healthy individuals. Placebo, you also give for comparing the placebo effects, comparison, and evaluate the method analysis. Drug safety information communication, FDA required, timely communication of drug safety information provide healthcare professionals, patient, consumer, and other interested person with access to the most current information concerning the potential risk and benefit of marketed drugs. Means while you're trying on the healthy individual or a patient, you must take a consent, number 1. Number 2, you must inform both things, the benefit of this drug and the risk which can happen during the trial, helping them to make some informed treatment or choice. Background, all drugs have risk, and health care professionals must balance the risk and benefit of a drug therapy when making decisions about whether to use the drug. The general risk and benefit of a drug therapy are described in the product description information, the leaf insert. If you go to the leaf insert, you will get all information on the drug. FDA provides information on drug risk and benefits to health care professionals and patients when information has generated a specific concern and has prompted a regulatory action, such as the revision of the drugs prescribing information. Example of important drug safety issues includes but are not limited serious adverse area identified after drug approval. Once the drug has been approved from the Ministry of Health, then when you are trying on the patient, you must be ready for adverse drug reaction and you must have all those drugs which can encounter such type of adverse reactions. In adverse drug reaction, you also need monitoring equipment like BP apparatus, stethoscope, ECG monitoring machine, and defibrillators. This is essential in that area. And drugs which can counter means corticosteroids or antiarrhythmics or some beta blockers or sonoport. These are the essential drugs should be there. These these may all lead to an improper use of the drug to prescribing or administering an improper dosage. Maybe mistake can be happen by the physician or the people who are conducting a trial. They will give a wrong dose and wrong route of administration. Or to a patient taking another medication with which the drug interact. So we must have a history of a patient, either is a diabetic patient, hypertensive patient, or any other disease asthmatic patient. So we must be on another drug also. So drug-drug interaction can take place, and we have to be very careful for that. FDA may decide to issue a public health alert or press release about a medical product or hold a media briefing to communicate important risk information. So this is the duty of FDA of the United States that this agency public give a public alert that this drug is has got such and such side effects or adverse effects or some other consequences like elevated sodium bisphosphonate group. It's a very dangerous drug because if you take and stuck in the esophagus, it will burn the esophagus. So we have to be very careful, and these alerts should be given by the FDA, even in the press release. When does FDA communicate emerging drugs safety information to the public? This is the duty of the FDA that should provide to the public also the information of any unsafe effect on the patient. So must inform the safe information. Safe information. FDA considered many factors in deciding whether emerging drug safety information should be made available to the public. So this is the duty of FDA to provide emerging drug safety information to those patients, especially who are in clinical trials. These factors may include but are not limited to the following: seriousness of the event, for example, severity and reversibility related to the benefit of treatment. Of course, the drug is very good, it will give a very good benefit. But, for example, Ryzik, we are using omeprazole, according to the American Ulcer Society. They say if there is a severe bleeding in the stomach, you can go up to the 80 milligram per day. In other way, we are providing 10 to 20 milligram. But the other severe side effects of that, along with the benefit, is that it causes a depletion of the magnesium. And magnesium, if depleted, then it will take the patient to the fits and convulsions. So, magnitude of the risk, for example, likelihood of occurring, as I have mentioned, strength of the evidence of causal relationship between the use of the drug and the adverse event. Means you have to find out the cause of the adverse effect and the drug. Is it because of the drug or drug-drug interaction or wrong dosage or wrong combination or wrong route of administration, extent of the patient exposure, how broadly the drug is used, disappropriate impact on particular population, children or the elderly, because they are very sensitive patients, children and elderly in they especially design a geriatric medicine for them, and we have to be very careful because their liver function is slow down, and in children also there is a development of their liver function and other organs. Potential for preventing or mitigating the risk in a patient population, for example, by monitoring patient selection or avoiding the concomitant treatment. Means side-by-side treatment should be avoided. Availability of the alternative therapy, if patient is not tolerable to these drugs, you have to change the drug and give the alternative therapy, change the medications. How does FDA communicate important drug safety information to the public? FDA creates effective and ongoing relationship with a wide array of the trade and professional associations, means from the pharmaceutical companies as well as from the doctors. Patient advocacy and consumer groups, means you have to educate. Advocacy means you have to train to the patient, give much information, and consumer groups also. Safety organizations, media and other entities. Tool and method to communicate drug safety information to the public. Use those tools. FDA approved prescribing information, for example, drug labeling, Drug Safety Commission, DSC, post market communication. What is FDA approval labeling? The label on the drug. Federal FDA approved prescribing information for healthcare professionals and patients, package inserts and medication guide for patients. This is must that each and every package of a drug must contain a leaf insert or prescription information in that package. It is the primary source of established information about drug safety and efficacy. It summarizes the essential scientific information needed for the safe and effective use of drugs. Means route of administration should be there, and quantity of the drug, and some more information of the drug. Yeah. Feature of the FDA approval labeling, patient focused information, patient labeling could be help prevent serious adverse effects. If we read, if we understand, if we go through the package, then that can be understand easily and helpful for the patient. Drug product has serious risk relative to the benefit of which patient should be made aware, because information concerning the risk could affect the patient's decision to use or to continue to use the product. A drug product is important to help patient adherence to direction to for use in critical to the drug effectiveness. Means we are giving any drug product to a patient for improvement, to get the result of improvement in his health. And patient should adhere to the direction for use as given by the leaf insert or by the physician is crucial to the drug effectiveness. Now, what is drug safety communication? The drug safety communication, DSC, is a specific tool used by the FDA to communicate to the public important information about safety issues, including the emergent safety information about the market drug. DSC generally communicates the following information: a summary of the safety issues and the nature of the risk being communicated, the established benefit or benefit of the drug being discussed. Recommended actors for healthcare professionals, the patient when appropriate. A summary of the data reviewed or being reviewed by the FDA. So now we see two cardiovascular diseases like angina pectoris. Definition. A typical angina is defined and diagnosed by three clinical criteria. How can you diagnose angina pectoris? Pain in the anterior chest means front side, often described as a tightness. Somebody is crushing your chest or squeezing you, or heaviness, or you feel a heaviness on your chest, front side. The discomfort is diffused and can radiate to the arm. If discomfort will continue, then it will radiate towards the arm, especially left arm. You will feel a pain, as well as neck and jaw. This is the typical angina diagnosis in a clinic. A patient comes with a pain of anterior chest, tightness or heaviness on the chest, discomfort that radiate to the left arm, neck and jaw. This is one of the most important way to identify or diagnose on the observation and complaint from the patient. Relief by rest or use of sublingual nitrates. If you will give nitrate tablets sublingually, it's a coronary dilators. It will relieve the pain. Angina is the main symptom of myocardial ischemia. Means if angina will continue, then it will block the circulation flow towards the heart tissues, and that will lead to ischemia, and that will lead to ischemia means lack of oxygen, and that will lead to infarction, damage to the tissue due to the coronary artery disease, CAD, restricting oxygen delivery. Risk factor for coronary artery disease includes a positive family history, smoking, hyperlipidemia means more lipid triglycerides, or very high triglycerides, or LDL, LDL. Hypertension, obesity, and diabetes mellitus are also a cause of angina pectoris. Type of angina: stable angina, pain induced by exertion and relieved by rest. If you are walking, if you will get a pain. If you are climbing stairs, if you will get the pain, it means it's a stable angina. And when you stop, then the pain will remove. Unstable angina, pain occurs at minimum exertion at rest, with frequently severe association with a risk of myocardial infarction that can lead to the damage of the myomeans muscles. Cardiac means heart muscles are damaged. Decubitus angina, pain precipitated by lying flat. This is known as decubitus angina. So there are three types of angina we are discussing. One is stable angina, pain induced by exertion and relieved by rest. Unstable angina, at the time of the at the minimum exertion of at rest, with little or severe association with the risk of myocardial infarction. Then pain precipitated by lying flat, that is known as cubitus angina. Variant angina, prismatal angina, we call it pain caused by the coronary artery spasm, severe obstruction, coronary atherosclerosis, restriction, myocardial blood flow, reduce oxygen supply to the myocardium in muscles of the heart, exercise or emotion stress myocardial oxygen demand, which cannot be achieved because of the obstruction leading to myocardial ischemia. Other causes or exacerbation of angina includes anemia, lack of hemoglobin or oxygen delivery, tachycardia, and left ventricular hypertrophy, oxygen demand. Onset of the pain is often sudden and resolved promptly with the rest as oxygen demand subsides. Some patients do not experience chest pain, silent angina, we call it. Others experience atypical pain, shortness of breath, and light headedness. Aim of treatment to reduce the symptoms to improve the prognosis. For example, prevent progression of the cardiovascular disease such as the MI and strokes, myocardial infarction and stroke. Assess the occurrence of pain in relation to the patient's lifestyle. Give advice regarding avoidance of precipitating factors, for example, heavy, sudden, and unaccustomed exertion, exertion in cold weather, and acute emotional stress where possible. Initiate optimal drug treatment, including the use of one or two anti-anginal agents plus drug for secondary prevention of the cardiovascular disease. Ensure patient understanding the importance of taking medication regularly and consider potential barrier to medication adherence and concordance. Provide lifestyle advice including smoking cessation, encouraging regular moderate exercise, healthy eating, and weight loss. This is all about today. We'll see you in the next lecture.